Every year, 805,000 Americans have a heart attack. Nearly half happen to people with no prior diagnosis of heart disease. And the number one reason people wait too long? They weren't sure it was serious enough. That uncertainty is what kills. So here are all 8 symptoms, what they feel like, why they happen, and the ones that mean call emergency services before this video ends. Symptom 1, chest pain or pressure. This is the symptom everyone knows, and the one most people still get wrong. A heart attack is not always sharp stabbing pain. In the majority of cases, it is described as pressure, squeezing, tightness, or a heavy weight sitting on the chest. Patients describe it as an elephant standing on their sternum. Some call it indigestion that won't move. Some feel nothing in the chest at all. It happens because a coronary artery, one of the vessels supplying blood to the heart muscle, becomes blocked, usually by a ruptured plaque. The heart muscle downstream begins to die within minutes. The pain is the muscle sending a distress signal through cardiac nerve fibers back to the brain. A key distinction: angina, chest pain from a temporarily reduced blood supply, typically lasts 2 to 5 minutes and resolves with rest. Heart attack chest pain lasts longer than 20 minutes, does not resolve with rest, and often builds in intensity. If chest discomfort has lasted more than 20 minutes, stop reading and call emergency services now. Symptom 2, pain radiating to the arm, jaw, neck, or back. Your heart is hurting, but your arm is what aches. This is not a coincidence. It is anatomy. Cardiac nerve fibers enter the spinal cord at the same levels, T1 through T4, as the nerves serving the left arm, jaw, neck, and upper back. When the heart sends pain signals, the brain cannot always identify the exact origin. It misreads the signal as coming from those shared regions. This is called referred pain. Left arm pain, particularly a dull, heavy ache radiating from the shoulder down to the elbow or wrist, is the most recognized pattern. But jaw pain, left-sided neck tightness, and a deep ache between the shoulder blades are equally valid heart attack symptoms and far more frequently missed. In women, referred pain patterns are more diffuse and less predictable. Women are significantly more likely to present with jaw pain, back pain, or nausea without any chest discomfort at all, which is a primary reason women's heart attacks are misdiagnosed at a higher rate than men's. A 2018 study in Circulation found that women under 55 are twice as likely to be misdiagnosed in the emergency department when presenting with a heart attack. Symptom 3, shortness of breath. You haven't moved, you're just sitting, and suddenly breathing takes effort. When the heart muscle is damaged, its ability to pump blood forward drops. Pressure backs up into the pulmonary veins, the vessels returning blood from the lungs. Fluid begins leaking into the lung tissue. This is acute pulmonary congestion, and it makes breathing feel labored, shallow, and insufficient even at rest. Shortness of breath occurs in approximately 50% of heart attacks. It often appears before chest pain or instead of it entirely. In some patients, particularly diabetics and older adults, it is the only symptom present. The critical detail: shortness of breath that comes on suddenly, at rest, with no exertion or prior respiratory illness, and is accompanied by any other symptom on this list, is a cardiac event until proven otherwise. Do not assume it is anxiety. Do not lie down and wait for it to pass. Symptom 4, nausea and vomiting. Thousands of heart attacks every year are sent home from emergency departments as gastrointestinal problems. Nausea is that convincing. The inferior wall of the heart sits directly adjacent to the diaphragm and shares nerve supply with the stomach via the vagus nerve. When this region of the heart is starved of blood, most commonly in a right coronary artery occlusion, it stimulates the vagus nerve, triggering nausea, vomiting, and sometimes hiccups. The patient assumes they ate something bad. The heart is the problem. Nausea as a heart attack symptom is more common in women, occurring in up to 50% of female heart attack presentations, compared to around 30% in men. When nausea appears alongside upper abdominal discomfort, sweating, or unusual fatigue with no obvious digestive cause, the heart must be ruled out first. Symptom 5, cold sweat. A sudden sweat that soaks through your shirt. When you haven't moved, when the room isn't hot, is your body's emergency response system activating. When cardiac output drops during a heart attack, the brain detects a threat to survival and fires the sympathetic nervous system. Adrenaline floods the bloodstream. Blood vessels in the skin constrict to redirect blood to vital organs. Sweat glands activate simultaneously. A physiological stress response identical to the one triggered by extreme fear or blood loss. The result is cold, clammy, pale skin combined with heavy sweating. The person often looks and feels unwell in a way they can't articulate. This combination, sweating without exertion, pallor, and a sense that something is wrong, is one of the most reliable indicators that the cardiovascular system is under acute stress. Patients who report this symptom describe it as the worst they have ever felt in their life, even before the pain becomes severe. Symptom 6. Extreme fatigue. A tiredness that arrives without reason and sits in the chest as much as the body. In the days and weeks before a heart attack, the heart muscle is often working harder than normal to compensate for a narrowing artery. This sustained extra effort depletes cardiac reserve and leads to a fatigue that is distinct from ordinary tiredness. It is disproportionate, unexplained, and does not improve with rest. A landmark 2003 study in Circulation surveyed 515 women who had experienced a heart attack. 70% reported unusual fatigue in the weeks before the event, making it the most commonly reported prodromal symptom in that group. Yet almost none of them connected it to their heart. Fatigue as a pre-heart attack warning is most commonly reported in women and is consistently underweighted in both self-assessment and clinical evaluation. If fatigue is new, unexplained, and accompanied by any chest, arm, or jaw discomfort, it is not tiredness. It is a warning. Symptom 7. Dizziness and lightheadedness. A sudden sensation that the room is shifting, that you might faint, that your legs are unreliable. This is your brain losing blood supply. During a heart attack, cardiac output falls. Less blood reaches the brain. Cerebral perfusion pressure drops, and the brain, intensely sensitive to even brief reductions in oxygen delivery, responds with dizziness, visual changes, confusion, or near fainting. This is not a separate neurological event. It is the heart's failure cascading upward. Lightheadedness combined with chest discomfort, sweating, or palpitations is a high-risk combination. It indicates that the heart is not just struggling. It is failing to maintain adequate circulation to the rest of the body. This combination requires immediate emergency evaluation. Lying down does not fix reduced cardiac output. Palpitations. An awareness of the heartbeat as irregular, racing, or skipping can accompany dizziness during a heart attack. Acute ischemia, the lack of blood to the heart muscle, disrupts the heart's electrical system and can produce dangerous arrhythmias. Some heart attacks present primarily as arrhythmia before any pain is felt. Symptom 8. The silent heart attack and the red flags. Here is the fact that changes everything. 45% of all heart attacks are silent. No chest pain, no dramatic symptoms. The heart muscle is damaged, a scar forms, and the person either attributes it to a bad flu, a pulled muscle, or nothing at all. Silent heart attacks are discovered weeks or months later on an ECG, and they carry the same risk of future cardiac events as symptomatic ones. Diabetics and older women are most vulnerable, as nerve damage can blunt cardiac pain signals entirely. This is why knowing the full range of symptoms matters. A heart attack can look like indigestion, a panic attack, a sore shoulder, unusual tiredness, or a virus. The symptom list is not just chest pain. These are the combinations that require emergency services called immediately, not a drive to urgent care, not a wait until morning. 1. Chest pain, pressure, or tightness lasting more than 20 minutes. 2. Chest discomfort with pain in the arm, jaw, neck, or back. 3. Shortness of breath at rest, sudden and unexplained. 4. Cold sweat, nausea, and lightheadedness together. 5. Sudden extreme fatigue with any chest or upper body discomfort. 6. Palpitations with dizziness or fainting. 7. Any symptom that feels like the worst version of itself. Pressure that is bigger than normal indigestion. Tiredness unlike any you have felt. A sweat that comes from nowhere. Trust that instinct. The data is clear. Every minute of delay costs heart muscle. At 90 minutes from symptom onset to treatment, mortality roughly doubles compared to treatment within 30 minutes. Now you know what most people learn too late. A heart attack does not always announce itself. It whispers first, in a tired body, a strange jaw ache, a nausea that feels slightly wrong. You now know how to hear it. Call for help the moment you do.